Welcome to the Western North Carolina School of Massage. My name is Dr. John Morgan, and today we're going to learn about treatment of one of the muscles that contributes to mid-thoracic back pain, posterior shoulder pain as well, and that is the latissimus dorsi and its little helper, Terris Major. We're going to start with our first technique, which is myofascial stretching to the area. Myofascial stretching helps to treat the connective tissue and perhaps to help increase hyaluronic acid flow, current research suggests. And we want to hold the myofascial stretch for about a minute at least. Fascia is primarily made of collagen, which is protein molecules, and therefore responds to mechanical force and heat, which is a property of connective tissue called thixotropy. And we're just helping to treat the connective tissue, and I'm going to move on just for time constraints, but we also want to focus on, you can see some nice red blood flow here, hyperemia, vasodilation occurring. We also want to do a focus of a stretch here at the lumbar region, because the latissimus dorsi attaches along the iliac crest here and onto this thick connective sheet of tissue called the thoracolumbar aponeurosis. So we want to focus our fascial work over fascia, and this is a form of fascia, the thoracolumbar aponeurosis. The latissimus also attaches to the upper thoracic spinous processes and then eventually crosses the glenohumeral joint to attach along the medial lip of the bicipital groove and has most of its effect on the shoulder. It is a powerful adductor of the shoulder and forceful extension of the shoulder. So it gets overloaded in things like climbing a rope, rock climbing, overhand throwing, where you're bringing the arm back down in extension, rowing. It's also a powerful depressor of the scapula by way of its attachment on the humerus, so it's also involved in things like dips, using parallel bars, crutches, and then some gentle myofascial rolling over the area. A client will complain typically of pain when the muscle is being overstretched, such as in reaching up and forward, which is lengthening the muscle. So, for example, reaching up into your kitchen cabinetry, the pain pattern for the muscle again is in the mid-thoracic area. It'll be painful right here. Once we've done some nice myofascial stretching and rolling, we can now come in, now that we haven't applied lubricant yet, and palpate the muscle on its free border here. It forms the posterior aspect of the axillary wall, axillary border, and this is the latissimus dorsi. Here's the lat, and this is just skin. It feels more gelatinous. It's just the epidermis, the dermis, and adipose tissue. So you want to reach in and pick up the muscle. And we're just going to do gentle pincer compression with opposing fingers or thumb and finger, and just gently squeeze and release tension in the muscle. We'll hold pressure for about 8 to 12 seconds at least to give the body time to respond to the touch, allow the nervous system to reflexively release. And we always want to communicate with our partner, make sure that we do not go beyond mild discomfort. Therapy of any sort should never be painful, but should feel good. So are we at mild discomfort or a little less?
It's
Would you like a little less pressure, or is this too much?
No, it's just right.
We're going to hold that, and we're going to move on just for time constraints, and you just move down a little further onto the muscle. Again, get on that right at the border of it and compress. Just to mild discomfort, no more than that. So we at mild discomfort?
Just right.
Okay, we're there. Life begins at the end of your comfort zone. And again, 8 to 12 seconds, or until the body relaxes. And continue just moving down the lat in thumb width increments to thoroughly treat the axillary border of the lat. You can also just come in, right there it is, you can see it. Right there, a little twitch response. Continue on down as far as you can until it starts to attach to the lower ribs. Sometimes it also attaches to the inferior angle in a few individuals. And then again merges into that thoracolumbar aponeurosis. Just gentle compression. And if you want, some nice deep linear fiber friction as well. And continue, still pick it up here and even here. It's the broadest muscle of the back. Right there's the muscle, and now just skin. So on our partner here, we can pick it up quite a ways down, right there even, and now just skin. So it starts to thin out. It's thinner down here and thickest here. So now that we've gently squeezed and compressed the muscle, we can come back in and treat its little helper. Terris Major is its little helper. Terris Major does the exact same actions. That's why it's called a synergist. It does extension of the arm, medial rotation of the arm, and adduction of the arm. The nickname of these two muscles is the handcuff muscles, because you bring your arm back in extension, adduction, and medial rotation. You're in the handcuff position. This muscle attaches at the inferior angle of the scapula, right here, and also slightly the inferior lateral border, and then crosses the glenohumeral joint to also attach on the crest of the lesser tubercle of the humerus. We can palpate it through the now softened latissimus by coming all the way in with our hand and squeezing, and right there I can feel the muscle, and it's a very different feel to your partner too. Lat may not be as sensitive. Terris Major typically a little more. Does that feel different to you?
It does.
So now we're going to identify that thick band of Terris Major, and now specifically squeeze the lat and make sure it's not painful. Are we at mild discomfort?
Yeah.
Okay. Anytime we go beyond that, will you let me know by saying a little less, please, or back off? And again, allowing the body to respond to our touch and relax. A lot of times just being still and allowing the body to go into a more of a parasympathetic state, which is our rest and digest state, helps to be still. And encourage your partner to breathe fully, completely, and deeply. And this also encourages the relaxation response that was studied by Dr. Herbert Benson at Harvard Medical University. Repetitive breathing causes the nervous system to go into a relaxed state. And again, maybe some linear friction to further coax the muscle fibers apart. And that's usually one, maybe two positions. The Terris Major's activating factors are just the same as lat. They're synergists. So again, doing things such as overhand throwing, lat pull downs, of course, using crutches, using a heavy chainsaw, and this forceful extension of the muscles can overload it. Climbing rope, rock climbing, can all overload these powerful extensors and adductors. Unlike latissimus dorsi, however, its pain pattern is typically not here, but the muscle refers pain to the posterior deltoid or posterior shoulder region. So a client can come in and complain of pain in the back of their shoulder, and based upon their activities, such as, let's say they just started taking up swimming and they're doing the butterfly stroke, which is a powerful, forceful extension as you push the water down and your body up out of the water. This is going to activate the latissimus dorsi and teres major. If you notice, a lot of competitive swimmers, they have very well defined latissimus dorsi and teres major. Okay, now we've applied lubricant, and once we've compressed and frictioned both muscles, getting the muscles to release and communicating our touch and depth of touch so that it's never painful, we can now apply lubricant and just gently glide along the muscles. Okay, this is just skin, so we want to get in here and effleurage, which is a gliding stroke, the lat. This is very soothing. You can also bring the arm out, abducted 90 degrees from the body. Remember, it's an adductor, so abduction is stretching it. Even bringing the arm further out and using the side of your hand and doing a nice swipe is a passive stretch while gliding on the muscle. Effectively treating the lat and its little helper teres major. You can also come down here and work along the attachment site, compress and friction along the iliac crest as well, and some nice gliding strokes over the thoracolumbar aponeurosis. And this is just a basic overview of treatment to the latissimus dorsi and teres major for mid-thoracic back pain and posterior shoulder pain due to overload in such things as climbing rope, rock climbing, or swimming. Or in the gym, chin-ups, pull-ups, lat pull-downs, rowing, anything that involves adduction and extension.